It is my pleasure to introduce you to Dr. Manuela Valle-Castro. Dr. Valle-Castro is the director of the Division of Social Accountability in the College of Medicine, and she is a well-respected advocate for social justice in the community. She's originally from Chile and has Mestiza, so Spanish, Italian, or Afro-Indigenous background, and she holds a master's degree in women's and gender studies and a PhD in gender, race, sexuality, and social justice from the University of British Columbia. Dr. Valle-Castro is an experienced educator, both in the university and community settings, and she is deeply committed to social, gender, and racial justice and equity. She has extensive experience developing and delivering anti-racist and anti-oppressive curriculum to a diversity of audiences. Prior to joining the College of Medicine in 2020, Dr. Valle-Castro spent the previous 3 years as the coordinator of the Saskatoon Anti-Racism Network. Under this capacity, she led coalition building and advocacy work with a range of actors, including Indigenous and settler organizations, as well as agencies and organizations that work with newcomers, immigrants, and refugees. It's my personal pleasure to introduce her, as I have had association with Manuela through an anti-Indigenous racism education course, and I'm sure I'm going to learn a great deal more today as I listen to her. So Dr. Valle-Castro.
Thank you so much for that wonderful introduction. Can you all hear me okay?
Mm-hmm.
Yep, okay. I'm using headphones just because everybody in my family is at home today, so I don't want to risk having any background noises from my children. Thank you for that introduction, and I want to express, first of all, my gratitude to Dr. Anita Chakravarti and her family for funding this lecture, but also for inviting me, for thinking that I was able to contribute something important to this discussion. As you know, my background is not as a physician. So I hope that my own experience, my own lived experience, and my own expertise can somehow contribute to your ongoing understanding of wellness. So the title of my presentation today, with exclamation marks, is Wellness is a Justice and Equity Issue. And I just wanted to give you a very brief background about myself, even though Karen has done a really great job at introducing me. I am Mestiza, meaning I have mixed background, and I am an uninvited guest to Treaty 6 since 2014, and to Turtle Island since 2005. And I grew up in Chile. I was born a year after a military coup. And after that, me and my family experienced exile and displacement, and our family also experienced a degree of political violence. And I got my training first as a clinical psychologist. I did first my practicum in community as a community counselor, went on to get the rest of my degrees, and then currently I work at the College of Medicine, and I'm also involved in a couple of research projects, one regarding gender-based violence, human trafficking, and women's security. And I'm constantly also engaged in teaching, training, and advocacy for gender and racial equity and justice. So I like to show you a map too, so you can put context to what I'm talking about. So I'm going to give you a spoiler and tell you, as it was described in the abstract, what is basically the point that I'm trying to make today, and what is the argument that I bring from my advocacy perspective, which is wellness is a justice and equity issue. That is, wellness is a result of policy and is a result of collective decisions rather than individual ones. I believe that wellness has been recently narrated, right, contextualized in a neoliberal discourse as if it were just the result of individual rational choices, right? So we just have to tell people how to make their best rational choices, which really renders invisible how structural our access to wellness and choices are. And because wellness is so entangled with things like housing security, food security, and economic security, but also very relevant to our context, intergenerational trauma, I propose that we need to frame wellness within an intersectional understanding of oppression and privilege. That's part of what I'm going to be developing today. I believe that using such a framework recognizes and addresses the impact of colonial policy, environmental racism, economic inequities, but other forms of oppression that even we can experience ourselves. Okay, things are going to get a little bit personal now. In the middle of a possible fourth wave of a global pandemic, I find myself overworked, overwhelmed by the present, and anxious about the future. I am privileged to be able to work from home, to own a house and a car, to regularly pay for my bills on time, and buy enough groceries for my family despite being a single income household. I can take breaks when I need to, and my job provides me with extended health insurance so that I can afford to go routinely to the dentist, checkups to the doctor, even massages. I sleep with an air purifier in my room to help with my asthma and allergies. I take my medicines, very disciplined, my vitamins. I eat plenty of fresh and varied foods. I am, for the most part, very well, and that is all a result of my privilege. And yet, some days, I find myself completely fatigued or unable to focus on work. Some days, my body refuses to be productive and demands that I go for a walk or lay down to sleep. I suppose listening to my body would be wellness, but then I would feel horribly guilty for not feeling well enough to work. After all, I work at the College of Medicine. My colleagues, physicians, are sacrificing their own wellness in extenuating working hours and conditions. And this kind of precarity has even been romanticized and elevated to some kind of virtue. So how could I tell them that some days my ADHD does not allow my brain to stay for long hours sitting, focusing on meetings while looking at a screen? That some days racial and gender microaggressions leave me exhausted? That I enter this space and institution with a body that has a history of experiencing different forms of political violence? For example, for most of my life, people have assumed my good health or wellness, taking my small body build as an indicator, the fact that I'm skinny. I usually never counter this to explain that I was feeling too stressed out to eat, or that as a result of trauma, I was unable to nourish myself more out of a self-destructive impulse than rather out of feeling well or being well. But weight and size have been equated to wellness in our current culture. Wellness has been equated to gym memberships, eating organic, drinking raw juices and smoothies, using a range of expensive Apple devices and apps designed to improve your wellness, and so on. Under capitalism and its accompanying ideology of individualism, wellness has been turned into a commodity and sold to ridiculous extremes to the super rich, who spend fortunes on treatments to give them, or that promises to give them always something new to improve an endless wellness. This point was really well illustrated by the journalist Lindy West in the article in The Guardian entitled "Gwyneth Glows Like a Radioactive Swan, My Day at the Goop Festival" in June 2015. in which she explores not only how wellness has been commodified, but also equated with the standard of living of the white and privileged. I live in the core neighborhood of Saskatoon, and people in my community are, for the most part, not well. Most of my neighbors live in economic insecurity. Many of them are Indigenous. Many people walk on the sidewalks of our neighborhood with physical signs of neglect and violence from our systems. In the face of the pandemic, we have all been instructed to practice good choices like isolation, physical distancing, use of masks, washing often. But you can't eat well when you live in a food desert. You can't afford to go to the gym when you don't have financial stability. You can't practice yoga or meditation when you're dealing with your own coping mechanisms to deal with intergenerational trauma or abuse. Wellness, I believe here, has very little to do with making the right individual choices and a lot with how those choices are structured to begin with. So going to that definition of, I was still sharing, forget about that. The World Health Organization defines wellness as the optimal state of health of individuals and groups, and it's achieved by a positive approach to living. I think somebody please needs to mute themselves. Thank you. Hold on, I need to stop sharing for a second. But again, sorry, I'm trying to not share while I'm reading. I didn't realize that I was sharing while I was reading. So that's the definition that we have for health, for wellness by the World Health Organization. But the structures of capitalism, colonialism, and patriarchy have distorted our understanding of wellness in several ways. We have culturally constructed ideas of what it is to look well. So think about how when you're sold ideas of wellness, who appears in those images? We also have a constant pressure to feel well enough to produce and work. So the focus on wellness is directly connected with the pressure to be well because we have to be productive. We have to be well to be productive. And this is all different from being well. And being well, I want to bring in how some decolonized ideas of wellness, both in North and South America, decolonized and indigenous ideas of wellness have everything to do with the ethics and the concepts of the buen vivir in South America, or the good living, right? And in North America, of course, we're familiar with the medicine wheel. And in many of these, I'm not an expert on indigenous health worldviews, but I do want to say that in the decolonized approaches to health, wellness is understood as a result of complex interconnections and relationships with our environment, with our communities, with others. So it emphasizes interconnectedness and the cyclicality of our lives, right? So that wellness can't be just the same thing for everybody or in the different stages of our lives. Wellness needs to be seen as in both those terms, interconnectedness and cyclicality. I'm gonna start sharing again. So to understand how our wellness is really a result of privilege and oppression, I wanted to bring in the concept of intersectionality. And you may have been hearing it it's become sort of like a buzzword, and people many times use it without the right meaning, I would say. It's been sort of a buzzword, but it's important to understand first that I'm going to show this first, that intersectionality is nothing else than a metaphor for understanding how we are always standing at the intersection of multiple forms or roads of inequality, and that these forms of oppression and inequality can compound themselves. And intersectionality did not come from academia. It came from social movements, specifically civil rights movement and the women's liberation movement. So what bringing these concepts does to our understanding of wellness is that, first of all, challenges the idea of meritocracy that is contained in wellness, that meaning that if you make the right choices, you will be well, and recognizes the existence of systemic barriers to wellness. It also acknowledges how some communities have been historically impacted differently by different policies. So in our context, it's very relevant to understand what are the accumulated impacts of policies that have allowed for white settlers' wellness versus what are the accumulated impacts of policies that have impacted Indigenous people's wellness. And of course, recognizing power, right? How power shapes our ability to be well in certain spaces. So racism has an impact on your wellness if you have to be constantly dealing with racism. Same with sexism and other forms of exclusion and inequities. And this form of analysis, again, understands that we live within systems, right? That our choices are structured by how we are positioned within these systems. And unfortunately, these systems that we have been born in already give us and assign to us certain value to our lives and our wellness. So colonialism, unfortunately, because it's based on white supremacy, prioritizes and puts a moral judgment on people of color that can achieve wellness, and it almost attributes the wellness of people with white privilege to their superiority, if that makes sense. Patriarchy, heteronormativity, ableism, capitalism, as I was saying, and the way that it allows people to commodify and accumulate wellness in very disproportionate ways. So we have people that have extreme amounts of wellness and people that have very precarious access to wellness. This is another way of looking at it, and then I'm going to show you yet another one so that we can understand that intersectionality is not just a concept that applies to understand the oppression of people of color or women, but also it applies to understand the privilege, right, of people who are occupying the dominant position in every one of these structures, if that makes sense. So as I was saying, in each one of these vectors, right, there's a dominant group and there's a group that is then by default othered or considered inferior. So when we're talking about gender, for example, we know that we live in a system that values masculinity and men and privileges the advancement of men over the advancement of women. We know that age is something that impacts our ability to have power in certain situations. So in each one of these vectors of power, there's always a you are part of the dominant group or you can be part of the oppressed group. But the interesting thing is that you're always experiencing certain degree of privilege, and you can also experience oppression at the same time, right? So it introduces complexity. Dr. Teresa Tam a couple of years ago issued a report in which she established that one of the main predictors of health in our country is income, right? Postal code and income. And we need to complicate that reading even further to understand how wellness is also affected by other things, not just income, but where we live, right? Our ability to access food, right? We know that in Saskatchewan in particular, we have places where the problem of food insecurity is so extreme that we can't expect any degree of wellness when the conditions that structure those choices again are so extreme and constrained. Okay. So while for people with a lot of privilege, wellness has been turned into a commodity that they can consume to levels of obscenity, to be honest. For people that are living at the intersection of multiple oppressions, and I'm citing here Audre Lorde because she was a woman, queer woman, and a Black woman. So she was interacting with several systems of oppression. And this quote talks about how caring for myself is not self-indulgence. Indulgence is a self-preservation. It's an act of political warfare. When the systems are constantly devaluating your existence and excluding you from power and wealth, then pursuing wellness is a political act. Yes. Okay, I need to stop sharing for a second. Again. And so, yes, these individual approaches to wellness that put the responsibility on individuals of making good choices, as I just said, allow for disproportionate distribution of wellness, where some have too much wellness and others have none or little. Whereas a collective understanding of wellness takes into account how things like environmental racism, right, the conditions where you live, whether you have access to clean water, housing policies, intergenerational transfers of wealth, food security and sovereignty, gender-based violence, racism, and others are shaping your access to wellness. So putting wellness in a frame of health and equity. So health, equity, and justice are grounded in the concepts of universal human rights. And social justice, right? It's to understand how people can access their human rights in their particular situations. So a health and equity framework aims to redress the inequities, right? The different outcomes and the inequalities, the discrimination based on gender, race, age, and other characteristics, right? Using an intersectional framework, and to achieve and pursue the highest level of wellness for everyone, for communities. When we use this approach to wellness grounded on health, justice, and equity, of course, then we look at things like, Indigenous wellness, of course, we know that there is a disproportionate amount of unwellness in Indigenous communities, right? And And these health disparities are connected to what we already know are social determinants as structural determinants of health. There's absolutely plenty and enough evidence that we know how these things are connected. And how, on top of that, there's colonial discourses that, because they're based on the idea of indigenous inferiority, they're looking at the unwellness of some indigenous communities and attributing that lack of wellness on their bad choices. So on one hand, we have economic inequities that are causing poor health outcomes. But then on top of that, we also know now that there's so much racism in the healthcare that people are avoiding seeking healthcare, in reality, indigenous people. And then on top of that, we have how these discourses of inferiority sort of like get normalized, right? People are just making bad choices. I wanted to bring your attention to some of the things that were established in there's been two big reports, as you know, coming out of BC lately that bring attention to health inequities in healthcare. I'm not gonna stop too much on these because I think you're probably plenty aware of how it's very well established that the wellness of indigenous people is completely intertwined with colonialism and colonial policy. Cannot be understood outside the context of colonial policy. And that actually addressing the wellness of communities that have been experiencing by colonial policy requires transforming the conditions in which they are. But most importantly, what I wanted to point at you is how this idea that individual choices, that individual wealth is rooted in individual choices, is that this is reproducing a lot of stereotypes, and particularly negative stereotypes about indigenous people when they come to seek healthcare. And these are some that are described in this report in plain sight that I imagine you're also very familiar with. It came out last year. And some of the stereotypes that are described there is that indigenous people are less worthy of care because they basically brought the condition upon themselves. Of course, drinkers, alcoholics, drug seeking, but also bad parents, right? Making constantly bad individual choices. The idea of frequent flyers, which we have learned that from our students that they also learned this in the clinical settings. They get groomed into using this kind of language. People are seen as irresponsible, less capable, and also unfairly advantaged, right? Like getting freeloaders, getting free stuff. So just to wrap it up, because I think I've been talking for too much, what I want to emphasize is that when we use individual approaches versus collective approaches to wellness, on one hand, as I was saying, when we look at it as an individual process or the result of an individual number of choices, we allow it to be disproportionate. We put the responsibility on individuals. We allow for a profit-driven wellness culture, and we construct the unwell as making individual bad choices. Lack of wellness, therefore, can be seen as a moral flaw. And we see these, for example, in the case of fat phobia, right, in which patients that are experiencing overweight are treated as being sort of like morally flawed, as a character flaw. Whereas collective approaches understand wellness, again, using these tool of intersectionality to understand how choices are structured depending of how much access people have to power in their life. Takes into account how choices are structured in a community as well, not just individually. It promotes community care over self-care. So it doesn't put all the onus of wellness in the individual of making good choices, but that communities need to care and need to have mechanisms of providing care for all of their members. And that finally, of course, this kind of approach believes that to advance wellness, we need to transform those structural and social determinants that we talked about. So that is my presentation. I remain very open and curious about your questions. And yeah, very excited to talk to you about what do you think about what I'm saying here today. Stop sharing.
Is there anyone that has any questions for Manuela? I know that.
Did I go too fast? Could you understand my accent?
Of course we can understand perfectly. Thank you very much for the talk. And I know that Karen might have a few questions, and please, for those attending, put your questions in the chat, and Manuela would love to answer them, I'm sure.
Yeah, and I apologize, Manuela. I just had a call I had to take, and of course it was the most inopportune time all day. So I'm sorry I wasn't there when you ended your presentation. Thank you, for your presentation. I mean, I've heard you speak several times about this. I'm still struggling to figure out, as an individual, what advice can you give us as to how we structure, how we look at our role in trying to change these things?
Well, so, do you want me to respond right away?
Sure.
I really wish that we would teach our medical students today about how much responsibility they bear, because in society we have assigned a lot of authority and value to doctors, right? We look up to you guys. You are like the best of the best for us. And I wish that more physicians would really act more as advocates to advance justice and equity, understanding that justice and equity and access to all these basic things that we have talked to are at the root of our wellness. And I wish that we would approach again wellness with more of a complex framework, that wellness doesn't always have to look the same, that wellness can look different in different bodies, cycles. That's why I was talking about cycles and relationships, that wellness is a result of healthy relationships, basically with ourselves, with our community, with our environment. And I also wish that we could shift what I talked about at the beginning, which is this physician culture of seeing overworking and burnout as a virtue, as something that it's expected, rewarded, and that we would really be honest about our wellness in professional spaces, and acknowledge that sometimes we're just well enough to function, right? This is what I also wanted to say too, that we have to decouple wellness with productivity, with our productivity. Wellness needs to be an end in itself and not a means to be productive.
Thank you for that. I mean, I think one of the things that you raised, because of my day job as the registrar of the College of Physicians and Surgeons, is to try and get physicians to have better work-life balance. And it's kind of the pot calling the kettle black when I ask my physicians to do that, because I haven't necessarily practiced that very well all my life as well. But I want to, because there may be people that have practiced outside of our province. We are very fortunate in this province to have the Saskatchewan Physician Health Program, which is under the auspices of the Saskatchewan Medical Association, which is the advocacy group. And it's a confidential service that provides assistance to physicians and physicians' families on a variety of stressors in their life, whether it be personal, professional, or a combination of the above. And that is not a model across the country. There are other programs across the country that have physician health, but they tend to be with the regulator. And what we have decided here is it's best with the advocacy group. They're not blind advocates. And that the relationship that we as a regulator have with that physician health program is extremely important in order for me to be able to do my mandate, which is to protect the public, but also to support the physicians in any way we can to extend their healthy life in medicine. So I wanted to put a plug in for that.
Mm-hmm.
I guess.
But
Yes.
oh, Karen, if I mean to your point, how can we promote individual physician wellness when there's structural conditions that make physicians work in understaffed and overwhelmed conditions? That doesn't make any sense. And it's insufficient, and it's not honest to ask people to be well and think positive and take care of themselves when they are put in structurally situations where they are gonna be burnt out.
Yeah, you certainly raise a good point, and we're seeing it in spades with COVID. Unfortunately, some of the decisions that have been made with respect to mandatory orders or not having mandatory orders does put our healthcare providers at risk, and therefore it puts our patients at risk, because if we don't have healthy workforce to help them with their non-COVID and their COVID related. So you're quite right. We have some, unfortunately, stark reminders of the structures that don't work. I wondered I asked the question about what can we do as individuals. If you had the ability to change anything with how our funders promote health and wellness, where would you start to make a difference?
In terms of physician health?
No, in terms of overall health for our population of Saskatchewan.
Mm-hmm. Yeah. I would stop making posters and brochures with white young people going to the gym as an image of wellness. I think that's so distracting and even trivializing of what wellness needs to be. It's almost as it's kind of like just starting to be honest about how some of us are able to be well as much as we can because we have privilege, and that we cannot ask people who are not in a position to make healthy choices, right? And we can't blame them for making unhealthy choices. One thing, to our funders. Let's see. Wow, I wish I could have thought about that question more. Promoting interconnectedness, I would say, as a principle of wellness, promoting interconnectedness and connection rather than you're going to achieve wellness by buying these number of things, you know, this app, this device, these foods, this, and rather to connect with your community, connect with the environment where you live, to have deep connections with yourself, not be separated from your body so that you have learned to exploit your body to make money under capitalism, right? Reconnect with your body around things that are not productivity and making money. As a way to reteach ourselves what wellness is really.
Thank you. Does anyone else listening have a question for Manuela?
Or a comment, you can completely disagree with me too. I'm up for it.
I think most of us are trying to catch up with you, Manuela. There's so many things going around trying to figure out where do we start on some of this. And I do agree with you that education about wellness, but also education about what has caused us not to achieve wellness in some aspects of our populations is really imperative. I don't know if anybody from the College of Medicine is on that knows anything about the curriculum, because I'm sort of out of date. You might know this yourself, Manuela, but how many hours or classes do the students now get that would focus on some of what I would call the social justice issues that sort of set the stage for having the mindset to be able to think about what we need to change in medicine as we go through? Has that changed over the last little while since you've been involved?
I think so. There's of course the whole medicine and society curriculum, and we're trying to introduce more anti-oppression frameworks, because even when you're teaching about social justice, you could still reproduce ideas of inferiority if you don't go deep enough in your analysis to explain and really understand why we have these inequitable outcomes in health. Because people have taught to read these outcomes as a result of just people's, again, choices, right? As opposed to a deep historical understanding of how policy has impacted people. And when you're saying that we need more education, it's true that we need a lot of learning, but mostly we need to unlearn a lot of things that we have already internalized that of what wellness is. So we need to go back and revisit those ideas and those, again, those images that we associate with wellness, with you know, we live inside this capitalist ideology that we're told that to solve any problem, there's something that we can buy. You know, we can buy our wellness, but there's just things that, you know, as the Beatles say, money can't buy. And I think that wellness is one of those things that have to do with something that it's more around interconnectedness, meaning, purpose, and connection, and that's stuff that we can't achieve individually ever, no matter how many we have.
No, you raise a very good point, and I don't know whether you were listening to Dr. Tatusis in one of the breakout sessions, but it was interesting because she focused on something which I hadn't really heard about before. I mean, I think we get overwhelmed with all that we're supposed to unlearn, learn, what's my role, what's somebody else's role. and she was talking about Indigenous wellness and the fact that we should focus on what our role is. And our role is not to be the spiritual, person that takes care of the spirit, but perhaps just recognize that there is some other important role for that, but it's not our job. So I don't know whether, anyone else felt like, to me, I sometimes feel overwhelmed at what I have to learn and unlearn. And I'm trying to parse it out as to how do we do this in some kind of iterative fashion, but it actually gets somewhere, because it seems like it's such a large piece of work that needs to be done, and yet we're not very coordinated in our efforts in doing it. If I look at all the players in the healthcare field, I mean, we're still, or not even just in the healthcare field. I mean, it's siloed government of everything. I mean, when we look at some of the issues with the Indigenous people, they come to the doctor for a bunch of issues, but when you peel the onion back, some of those are justice issues, some of them are social issues, some of them are health issues, some of them are, and so our physicians are not well skilled necessarily in peeling all that back and recognizing they're not responsible for the whole piece. But where do they go? Where do they go? So how do we unlearn things like the construction of the governance of the system that sort of makes this worse for us to deal with? Because I know I've been criticized in the past by people that, the college doesn't necessarily listen to the stakeholders. And I said, well, you guys should look at yourselves. I mean, since what time have you sat down with your social services, your education people, your justice people, and your medical people all at the same table to try and figure out how best to manage whatever the situation is? So I guess just listening to people like you and educating ourselves and asking questions and listening to the answers and then listening to those people that are impacted will help us. But I feel it's a
I
big.
guess none of us can fix this individually, like you're saying. Individually, we can't fix it all. We need to act collectively and make sure that we are making decisions that are addressing those things that we know already need to change. Now, I think that the practice of medicine, of course, has always been immersed in culture, in our broader cultural sensitivity, and that's been changing, as you know. We have been writing two main cultural shifts. One by the Me Too movement, so everything around consent and sexual violence and gender-based violence, it's on the table now. When we didn't used to talk about openly about that, and of course, Black Lives Matter, and in Canada, I don't know more. We are changing the way that we're looking at things, and that is permeating the practice of medicine, of course. And there is a generational change, I guess, a generational change that it's happening as well, so that these frameworks are going to be the dominant. They're going to be the mainstream eventually, right? That they're going to be the way that we understand wellness and equity. So I don't think that individually we have to commit to change everything, but it's really good to start doing the work on ourselves. For example, thinking and having a reflection on being honest with yourself of how much of your wellness has to do with privilege. And yet, regardless of where you are in your privilege, where are the places where you still are unwell, and what does that have to do with? Where are the places where you need from the community or from your land or from yourself, from others to be well? And I really want to demystify this idea of the overworked physician as a hero. I think that, as you were saying, with the pandemic and the pressure on our essential workers and our health workers created this idea that they're heroes because they're working in horrible conditions. And that's something that, I mean, we applaud because we're grateful, but it doesn't need to be like that. And it shouldn't be like that. I don't think it needs to be like that. And I think we can make better decisions to ensure that that is not the case.
Well, thank you for that. And I think that probably our younger generation of physicians is doing a better job at least attempting to know what a better work-life balance is and what actually means something in the world in terms of contributing outside of their main job. So anyone else have any questions? There's some comments. People are thanking you for your lecture and your energy and wishing you well. Sylvia Hicks says, Manuela, I really like your ideas, but I can't see steps to implement it.
Steps to implement it in your life, in your practice? Well, I think my particular role in the College of Medicine is to make sure that these frameworks, again, as I was saying, are introduced in a transversal way in the curriculum and in the culture, in the work culture of physicians, right? That we are not better than anybody else, not worse than anybody else, just equally important as everybody else. And that so that's what I'm trying to do, to really change the culture, introduce these frameworks in curriculum, introduce different ways of framing this with faculty, trying to advance these frameworks. But it's not easy, it's complex. It's not a simple situation that will be fixed with a simple solution. So I think we have to think long-term, we have to think collectively, and we have to think, you were saying something really important, Karen, that our college and our health system is kind of siloed and hierarchical and like, boxed in ways that it's hard to collaborate and make sure that things are flowing, ideas and, are flowing around. But I have seen just in my short time in the college and my interactions with the health authority and the Saskatchewan Medical Association that there really is an openness and an already ongoing shift in how people are thinking about this.
Thank you for stimulating that additional conversation, Dr. Hicks. Anyone else have any comments for Manuela? Any other questions? I mean, I could talk to her for another 2 hours, but I'm sure she has other things in her day to get onto. So as I don't see any additional questions, I would like to thank you very much for a really provocative conversation and subsequent dialogue. I think with people like you, you will stimulate those of us that have been educated in a system that was pretty structured to think outside and to start to reflect and question what are better ways of doing things. So thank you once again, and I'll hand it back over to Derek.
Thank you, everybody.